All right, welcome everyone. We have another episode here for you today. I am so excited because we have a special guest. We have Dr. Ndidi Amaka Obatan here to the stage, and she is a hypertension expert. And we're going to learn some about high blood pressure, and we'll also learn about how high blood pressure interacts with exercise. So we have a treat for you today. So Dr. Ndidi, please introduce yourself, tell us what you do and who you serve.
Thank you for having me, Dr. J. Well, my name is Dr. Ndidiamaka Obadan. I'm the CEO and co-founder of Younger Self MD. It's a medical practice aimed at preventing and treating adults with chronic medical conditions like hypertension, diabetes, and chronic kidney disease. I'm board certified in internal medicine and nephrology. I am a mom of three beautiful children and a wife to my adorable husband. Well, most of the time.
Awesome. Well, we it's a treat having you today. So let's start off with our questions. So for people who don't know, what is hypertension and what causes it?
So, hypertension or high blood pressure is a medical condition that occurs when the blood flowing through your arteries is higher than normal. It's generally should be less than 120 over 80. There are two numbers, the systolic, which is the higher number, and the diastolic, which is the lower number. So anything less than 120 over 80, that's normal for you. If your blood pressure is between 120 to 129 over less than 80, that's elevated blood pressure. Stage one, hypertension, is when your blood pressure is between is greater than 180, 130 over 80. I'm sorry. So when you have high blood pressure, your blood pressure is greater than 130 over 80.
Mhm. Great.
That's
So,
stage one. So stage two is when your blood pressure is greater than 140 over 90. I didn't know if you wanted me to go into all the details of the staging and all that, but so I think to simplify it, once your blood pressure is greater than 130 over 80, you have high blood pressure.
yes. So thank you for that because sometimes patients, they may get confused about, oh, what is considered high blood pressure and which guidelines are you citing from, just so patients also know.
That's a good question because there's so many guidelines, and you will determine the blood pressure thresholds according to what medical condition you have. But I use the American College of Cardiology and the American Heart Association guidelines for general adults. So this is for everybody in general.
Mm-hmm. Yes. So that's very helpful because um, there's also another guideline, JNC8, and the hypertension threshold for that starts at 140 over 90. So usually the nephrologists and the heart doctors will use 130 over 80 as the threshold for high blood pressure, and usually the primary care physicians will use 140 over 90. So this is just to help clarify some of the information because I know that sometimes patients may get confused. It just kind of depends which guidelines they're getting the threshold from.
Correct. And if you have chronic kidney disease, your nephrologist will probably go with the the KDIGO guidelines as well. They have special guidelines for kidney patients.
Yes, yes. So thank you for helping us to clarify that. And the next question is so, exercise can open up our blood vessels, and there are antihypertensives that have the same effect. So, what should people be aware of when they're exercising and taking certain antihypertensives?
Well, that's a good question because sometimes people are exercising and suddenly they start to have dizziness or lightheadedness or they have chest pain, or they just feel more tired than normal. Or in other population, they may have, especially women, they may have symptoms like nausea or just not feeling well. Those are signs that something else might be going on. If they're on certain medications that cause their blood vessels to dilate, that will cause their blood pressure to drop even more and will lead to those symptoms. So what I recommend is when they start having those symptoms, you should definitely slow down, stop, get a chair, and sit down for a couple of minutes because we don't want you falling and breaking anything. And have somebody call 911 and take you to the nearest emergency room so that your physicians can evaluate and make sure that you're not having an emergency.
Mhm. Yeah, that's extremely helpful. Even though we use these medications to treat blood pressure, they can have a compound effect when exercising. So it's important to be mindful of that and go to the emergency room if you develop any of those symptoms. Uh,
I think I missed one of your questions where you asked about the causes of high blood pressure.
okay, yeah,
Yeah.
we can go back to that.
So yes, I was going to tell all of us, remind us that we have there are two different types of hypertension. Primary hypertension. The cause is unknown. Well, at this point, we think it's due to genetic factors or certain other risk factors that predispose you to have primary hypertension or essential hypertension. You might hear your physician say that. So what are those risk factors? Age. The older you get, the higher the risk of you having high blood pressure. Um, if you're overweight or obesity, that's one of the other risk factors for that. Familial history, family history. We have someone coming in. Hello, sweetie. Give me 1 minute. Okay.
Mhm.
Family history. So if you have one or two parents who has high blood pressure, your risk of having high blood pressure is twice, is double than someone who doesn't have parents with high blood pressure. Other things like, lifestyle factors. I think I mentioned obesity, high sodium diets. The average American diet has more than 3 grams per day of sodium in it. So that's excessive. Excessive alcohol consumption and reduced physical activity. Those are some of the risk factors. Now, the secondary causes of hypertension is one where we can identify an actual cause. And this can be due to endocrine problems like, problems with your thyroid, problems with your adrenal glands primarily. Obstructive sleep apnea, that's a big one. People who have obstructive sleep apnea can definitely have that. People who are on certain medications like cocaine or amphetamines, or even over-the-counter NSAIDs, ibuprofen, Motrin, Aleve, naproxen, there's so many of them. Those can cause you to have high blood pressure as well. And of course, kidney problems. There's so many kidney problems that can cause you to have high blood pressure. I don't want to bore you, but there's a long list
Mhm.
of
Mhm.
secondary causes.
Yes.
So you definitely need to follow up with the physician and start, getting evaluated so that they can identify the cause.
Yeah, yeah. Thank you so much for breaking that down because we hear the term high blood pressure all the time, but there are all those causes as you mentioned. So it's really important to follow up with your primary care physician to help delineate what's going on and what's causing that. All right, so this brings us to our end of our segment. Thank you, Dr. Ndidi, for blessing us with your expertise. Is there anything you want to leave our audience with today so people know how to find you?
Well, thank you. Thank you so much for having me, Dr. J. It was a pleasure, and I hope you'll invite me for future sessions. My medical practice website is www.youngerselfmd.com. You can follow us there, and you can definitely follow us on Instagram at youngerself.md.
Awesome. Thank you so much. And as you know, please subscribe to this channel. I will put Dr. Ndidi's links in the description so you can easily access them. I am also on Instagram at MedFitDO. And if you are a busy professional woman with a family history of chronic illnesses like diabetes, hypertension, high cholesterol, or you may have someone who even died from complications of a chronic disease, and right now you feel organized in every part of your life and your career, but your health, I'm inviting you to schedule a one on one call discovery session with me. That link will be in the description below as well. All right. Well, thank you so much for listening to us. We'll see you next time. Bye.
Bye.